You're listening to a two-part podcast featuring Dr Ngaire Brown and hosted by Ngiares, talking about the benefits of a regular 715 health check.
Well, thank you very much for joining us here on this podcast. It's a one-off about the 715 health checks. My name is Ngiare, and I will be hosting today, but also share some of my experience of having recently undertaken my first 715 health check. I can't believe I didn't know about it before now. I'm 35. How come I didn't know about it? So it's interesting to go through it and to find out that my sister actually has a 715 every year. So even within our own family, we weren't kind of all across it. But what we're here to talk about today is the 715 from the perspective of a patient as well as a doctor. And I'd like to introduce Dr Ngaire Brown, who is one of the first identified Aboriginal medical graduates from New South Wales and one of the first Aboriginal doctors in Australia. Hi, Dr Brown, how are you?
Morning, thanks for thinking of me.
Oh, of course. It was a no-brainer and they said, look, we'd really like you to go and have a chat with a doctor. Obviously, you're not my personal doctor, so as I tell my story today and share my patient experience going to get my test and talking to various other people around this project, it won't be the relationship that we had in the room, but you'll be able to tell from your many years of conducting health checks with our mob.
And speaking of many years, if it makes you feel any better, I recently turned 50 and I thought as part of my birthday celebration to me this year and for every subsequent year that I too would then go and have my comprehensive health check done, which is good and timely for a variety of reasons, but it's never too early and it's never too late to get into the habit.
And it's really nice that you position it like that in the way that, taking care of yourself is a gift. And it's one of the things, it's not just let's go out and chuck a party, but the best thing I can do to honour myself on a special day like your birthday and every year is to go and check in with your doctor and see how your health is going.
Absolutely.
Now, I'd like you to introduce yourself, if you don't mind, just a bit of your background and where your mob's from and what inspired you to become a doctor.
Oh, so very short answers is what you're after there.
You can give us some more.
So I am a Yuin Nation woman, so my father and my grandmother's country is around the Shoalhaven. So, and I grew up here in the Illawarra. I've been away for many years, but was drawn back here for a variety of reasons. And we were just discussing how beautiful a place this is. Yep, I'm a doctor by trade. I have a background in a number of disciplines. My first love was emergency medicine before I moved specifically into primary care and into Aboriginal and Torres Strait Islander health, which of course I adore. And it's what I'm completely connected to, and I work with Aboriginal and Torres Strait Islander children and adolescents specifically now. I run a small not-for-profit called Ngiare, and we deal particularly with children affected by trauma and with complex needs, and we do outreach to a number of communities, but also, as you know, I do a bit of work in policy and other areas. So, but a complete privilege to work in Aboriginal health.
And we're very lucky to have some of your time today, so thanks for sharing. So what was it that made you want to become a doctor?
You see, that's a good question, and I decided very early on, so probably obnoxious / precocious in that sense. I used to think that it was because I really liked MASH, that was one of my favourite shows ever. I thought it was also because I love science, so I'm a tad on the nerd side, and wanted something that I loved science, but I also love the notion of being able to work with people every day and to connect and to have relationships and to hear those stories because they're gifts each and every time. But it was, I happened to be out in community one time, and I've heard this story a number of times since in different contexts, but a similar kind of theme. I was out with another Aboriginal doctor who shall remain nameless, but it'll probably become evident who it is. So we were out in a remote community, we were doing some work together, and one of the elders, the senior women, she kind of points at us, but she calls us over. And she points at him in particular and says, "Are you one of them Aboriginal doctors?" And he goes, "Yes, Aunt, I am." And she waves a finger and she said, "You know that you didn't choose to be a doctor." And he's kind of a little perplexed, but told her, and she says, "We chose you." That's still goosebumps for me. The notion that, in fact, I always try to acknowledge that we stand on the shoulders of giants. All of the ancestors, my family members that went before me, that paved the way such that we would have choice and opportunity. And then to also know that our senior people our ancestors, spirits, whatever. I don't know if I believe in fate or destiny in that sense, but I do believe that there are certain pathways created for us if we're open to the experience to know where we're needed. And I think for me, that's probably the nicest story.
Certainly is. I've got tears in my eyes just hearing it, and it's nice to know that kind of our cultural upbringing and beliefs have crossed over there in that story with medicine and choosing you. So, and it's knowing you as a person, it's no doubt that you were always meant to be a doctor, very caring person. Why is it important to have Aboriginal and Torres Strait Islander doctors?
Well, I think because we have such extraordinary potential and talent in communities. And, if there were, kids, young people, adults who were privileged as I was with the same sorts of opportunities, you would see us flourish. I think that we have extraordinary insight. I think that our cultural connections actually then help to enrich the medical profession in terms of what we can offer and bring. Medical schools, the health profession, they're not doing us a favour in that sense, if you know what I mean. Because if we are provided with the right kinds of environments and mentors and support, then what we can do in turn for the environments and the teams within which we work can be extraordinary, and we can actually lift the health game and we can lift the profile of the entire population, not just Aboriginal and Torres Strait Islander peoples. I think it's also really important that we provide, and I'm not saying I do, but I would like to, I hope, but the notion that, we should be role models and we should provide something that our children can aspire to in terms of achievement and success, and that, we don't just have to work in certain areas that are dictated to us. We can choose and we can be great in whatever we desire to do. And I think that's important. Change our social norms and raise our expectations and the platforms by which we experience being Aboriginal and Torres Strait Islander peoples.
And as an Aboriginal or Torres Strait Islander patient, I'm sure you've come across over the years that just in the same way that the story you've told us about the auntie who said, doctor, we chose you to be a doctor. How do you think it makes patients feel to have an Aboriginal and Torres Strait Islander doctor?
I have been lucky enough that on more than a couple of occasions, I've actually had my patients say to me, don't you worry about what other people say. Because, of course, there's always going to be the haters, right? And you can't be black because you're educated, or you can't be black because you have a roof over your head, or, you earn a good income. They said, don't you worry about that, because, we're very proud of you and what you've done for us. And for every 1,000, negative comments you get, it just takes that one to really just, fill your heart again and make it all worthwhile. Can I tell another story? And I hope he doesn't mind me dobbing him in, but Kelvin Kong, another fabulous young man, great family. When he was a very young doctor, just graduated, I think, and he was seeing a lady in clinic, and I just started sort of the interaction with her, and he saw her get really emotional and weeping. He goes, oh my God, what have I done? I've made my first patient cry. And he goes, Aunt, what's wrong? And she said, you know what, I am so proud. I didn't think I would live long enough to be treated by an Aboriginal doctor. So they're the stories that we hang on to.
Another beautiful one. I'm going to have to pull it together here. Yeah, it just certainly does make you proud, and not just because you're an Aboriginal or Torres Strait Islander person, but because you're fabulous doctors as well, and have all of the right skills to be just as good as carers as anyone else out there when you walk into a room, probably because of our culture and, having culturally appropriate environments and care and expectations when patients come in. Can you tell us a little bit about the importance of culturally appropriate care when patients come to a clinic?
So I think there are lots of strands and perspectives to that, and I'll try and capture a couple of those. So, our notion that sort of traditionally, culturally, we are an inclusive people, we are a collective. So the notion that we know not just to deal with an individual, but all of the other factors, relationships, people, environments in their life, that's extraordinarily important. I think perhaps because a lot of Aboriginal and Torres Strait Islander mob have experienced barriers, discrimination and exclusion in their lifetimes and the lifetimes of their families, parents, carers, grandparents, whatever, then we know what to expect, but we also know that they are not the things that we should be engaging in, and so we need to do our jobs better in that sense. I think it's also fabulous when we have, say, the community-controlled services, but also non-community controlled and mainstream services that want to be relevant to Aboriginal people, have Aboriginal and Torres Strait Islander staff, not just doctors, that are part of the service. So really friendly, beautiful coloured faces at the front desk, Aboriginal nursing staff and allied health professionals and receptionists. Have areas that may have, gear for the kids to play with, have artwork on the walls, have printed material or other media running in the background whereby people feel that they are acknowledged and they are relevant and that they are valued and that they have the same kinds of or perhaps additional concerns than other patients do, but they can still be part of this service, which of course they're entirely entitled to.
I think you've pulled that all together really nicely for us there, because that's a really important part of getting a health check, feeling comfortable in where you're going. It can be quite, you can get a bit nervous about going. You never know what the doctor's going to find out, or it's always nervous in the waiting room, I find, kind of looking at people and do I have the right doctor? Who am I going to see today? How long is it going to take? There's just all these questions that you get nervous about kind of sitting in that kind of space. So having a welcoming, friendly space where it's easy to come in and check in at the front before you even get into the doctor is really important, I find. Now, can you tell us what an actual 715 health check is?
So a 715 is it's a health check that Aboriginal and Torres Strait Islander peoples can have done on an annual timetable, but it should be comprehensive in nature and offer you not just the usual hi, how are you, what's your name, where you live, but take full consideration of your social background and social histories, ask you about your family history. Is there anything important, not just in your own personal medical background, but that of your family, so we can take that into consideration. We know that we have many families with long backgrounds of chronic disease, for example, diabetes, cardiovascular risk, and they're super important when we're considering how we tailor, our history, our examination, our investigations, and then a treatment plan for you. It goes through the steps of that history, and they'll ask you questions about, you've got a job at the moment, or where you're working, what are you exposed to, what are your interests, do you play sport, are you involved in any other sort of social activities, cultural activities, for example, which I think is really important. They'll then make determinations around the kinds of examination, if they need to tailor that at all, depending upon your age and where you live and your access to services and what your history brought up, for example, male or female, young or old, and then the investigations, an x-ray, for example, or some bloods taken, and referrals as appropriate. So for allied health professionals, podiatrists, nutritionists, diabetes educators, but also perhaps you might need to see a cardiologist or a diabetes and endocrinologist as a specialist. And then we wrap that all up in a specific and individualised kind of plan for you that we discuss and we negotiate and we try to educate so that, you then are able to play a part in your own health and take responsibility for some of those aspects, but also you then get to choose what you share with family and the other providers. It's supposed to be a relationship and partnership for your health that you understand, that you agree to, and then together you can move forward on how to be healthy and stay healthy.
That's a great snapshot, and I'm going to share kind of my experience in going to the doctor and the test shortly. But then another thing to note is the 715 is the Medicare code at which doctors need to claim. So that's why it's called a 715. Sometimes they're called, just an Aboriginal health check, or go to the AMS and get your health check, or different communities call it different names, but that's what we're talking about. So it's for Aboriginal and Torres Strait Islander people every year to go along and be proactive about their health. And let's not wait until, there's a problem coming up or that you're sick. And in some communities that we visited and talk about this, they have said that it's their policy not to see any patient who has come in with a rolled ankle after footy, because that's not the purpose of the visit. We want you to come in and do the full checkup that is required for a 715. So why is it important for our mob to get a 715 health check?
Oh, multiple reasons. I think, so for me, just from my perspective, sort of professionally, I suppose, I think it's an opportunity to try and get ahead of any issues that you may already have, or any issues that you may be at risk of developing, for example. Does that make sense? Mm-hmm. But, I think it's about changing how we think about health and well-being. We always talk about prevention, but we don't do much in that space. So if you have an opportunity to have a comprehensive health check done, a 715 that's bulk billed, it won't cost you anything except your time. But to then give you a snapshot of where you're at, what you're doing really well and what we need to support you to do better, for example. And then for you to be able to share that experience and those stories with your family members and those in your sphere of influence. Because, historically, I think we've had very poor or negative interactions with the health system. We tend to wait until we are quite unwell, and wait until we already have a handful of complex conditions that we need to deal with, which means we are unwell. It means we're not at our peak to be able to maintain ourselves, and then the people that we care about and love, raise our children, care for our elderly, do our jobs. So why wait, as you said? We need to get ahead of that, change our expectations and our social norms about well-being. And it's an interesting, I think, it's not a contradiction per se, but Aboriginal and Torres Strait Islander mob and Indigenous peoples everywhere always talk about well-being. In fact, we're at the forefront of those conversations about being socially, culturally, as well as personally well. And yet we don't tend to do that. So we have an opportunity now to be able to access, items and activities and services within the system to help us get well and to stay well, but also then to role model those sorts of positive health behaviours for those around us, and particularly our kids.
And some people might have the perception that, there's a lot of bad health in my family and I'm going to get it anyway, so what's the point in going to the doctor? That kind of defeatist attitude almost, which I hate to generalise, but a lot of the young men in particular are tough and feel like they don't need to go along and get a health check. What would you say to those kind of people out there who are thinking that they're that person, about why they should go and get a health check?
Yeah, so as a public health check, I would say absolutely there is a significant proportion of our health issues are preventable. Absolutely. So whether we're talking about issues of physical activity and BMI and weight and, your blood sugars and heart disease, are going to risk factor profile in our teens and early 20s that most non-Aboriginal people don't see until they're in their 50s, we can do so much about that. And so the notion then that we can get ahead of that and just make it a routine. When you're young, maybe every 2 years, have a regular checkup and make sure you have that stuff checked. But also then it makes you think about healthier choices, better options on a day-to-day basis. And particularly for our young men, I know it's really difficult to be a bloke, to be an Australian bloke, because it's just expected that, I'm sporty and I drink beer and it's, that's fine. I don't talk about emotions and I certainly don't talk about things like having regular health checks. You then layer on top of that all the social and cultural complexities to be an Aboriginal or Torres Strait Islander male, then it really becomes a really crowded space for them. But we want to break out of that and, in fact, re-engage our young men to be leaders in this space and to have them be the role models and to say, look, you know what? And I think there's a number of organisations now that are very much focused on the fitness aspects of not only physical well-being but mental health and how we teach our kids, we teach our families, and then, we become, entire communities that are role models. But re-engaging our men, I think, is important because for a bunch of historical and contemporary reasons, I think they've had a lot of their power base removed. So getting them back into a place where they're comfortable and feel powerful again, I think will be important.
Absolutely, some really good advice there. And it's interesting about that kind of layering on. When you point it out, it's like, yep, it's obvious. And so I'm sure we can all encourage each other. I know I have girlfriends. Whenever I go to the doctors and get something done, I privately text them, say, went and got that done. Have you had yours done lately? Just to make sure that we're checking in and looking after each other. Probably could be a little bit more open about it because, you never know who's going to see that in terms of role modelling and letting people know about it. And the fact that my sister's going for a 715 and we never talked about it. I could have been on it earlier. So yeah, that's why it's so important to, and the first one was always, I think, in life generally, the first one's always the hardest. Once you've done it, you've gotten through that first one, you know what it's all about, then you can kind of know what to expect next time and invite some of your other family members along to go and get theirs done too.
No, I agree absolutely. And I think because, as I mentioned, a lot of our being the Royal Owl, experiences have been quite negative in the past, but to change it to something that is actually a positive. Oh, my blood pressure was perfect today. Thumbs up. And then you go, okay, well, it's like we do the community weight loss challenges and things like that. You're turning something that is a health risk into a health positive because you're celebrating the successes. And actually, like you said, after you've done the first one, it's like, well, that actually wasn't so bad, was it? So what I'm going to do is I'm going to, if we challenge ourselves, I want to improve on that. I want to maintain my weight, or I want to improve my blood pressure, or I want to get myself off my diabetic medications because I can do that through diet and exercise. Things that are as simple as that, you can actually access the appropriate supports to make that happen with something as simple as a 715.
Now, perfect timing, because I'd like to just chat through the process from where to go for anyone who may not have had a 715 or know what it's about. Hopefully you're listening to this podcast, you already learnt a fair bit about it already. So right now I'd just like to talk through some of the logistical steps. So the first thing, a question that comes up is, why should you identify as an Aboriginal and Torres Strait Islander patient at your local clinic doctor?
Well, apart from the fact that, we should all be extraordinarily proud of that, it's important from a very nerdy, boring perspective around statistics, but also access for services and for staff and for patients to Aboriginal specific health entitlements, which is important as well. And so that way they should be notified that you can be bulk billed for certain services, that you are then entitled to perhaps a cluster of referrals to certain other allied and specialist medical services because you're an Aboriginal and Torres Strait Islander person. And also, I think it gets the services to think more about you as an individual, about you as a cultural person, and also what they can be doing better. So they're just some of the little snapshots that are important to me to know that patients are Aboriginal and Torres Strait Islander. But also, if there are issues, and they might be social issues as well as health issues, then we also know that we can access additional services and supports for them irrespective of what they might be.
Can you tell us a little bit about bulk billing for those people out there not quite sure what it is? I wasn't sure what bulk billing was. What does that actually mean?
Well, the bottom line, it just means that you will not pay out of pocket or should not have to pay out of pocket. And even for some of the services that claim against that item when you have your consultation, or if there are any other service fees, then you are entitled to a full refund of that amount. So you will not be out of pocket.
So to get your 715, you can go to your local AMS or bulk billing doctor. There are some doctors out there that don't bulk bill, which means they will charge you. You can still go there and have the test, but it will be at a charged rate. So if you're thinking of going and getting 715, it's best to go to your local doctor that already kind of knows you. But if you call up and just say, do you bulk bill? And if they say yes, then that's the right doctor to go to for your 715, and then you won't have to pay out of the pocket to have that test.
No, so that's absolutely right. And on that, so whilst we know that we have a good network of community-controlled services, Aboriginal medical services, there are, a vast number of primary care providers and group GP practices. What's super important, yes, the financial considerations, absolutely. Irrespective, though, you should be able to claim against the 715. But having a provider that you can build a relationship with is very important, because then you're more likely to go in a timely manner, you're more likely to trust them with very sensitive information, and you're more likely then to refer other Aboriginal and Torres Strait Islander peoples there.
And on that note, I previously went to the same doctor as my parents. So the doctor already knew the family history, knew probably more about their history than I knew, because that's my parents' doctor. But then I moved. So then I went and found a new doctor because people are busy. I don't have time to drive across town to go to that particular doctor anymore. I want to go to the one kind of closer to me. So there are lots of reasons why people go to different doctors. Our mob move around a lot, travelling, visiting family around different parts of the country. Can you give us some advice around why it's important to build that relationship and go to the most frequent doctor over time?
So I think you've already sort of mentioned issues of trust, relationship, and them being familiar with you and your story and the story of your family, which is always a gift. So it means then, for example, just in terms of, to be blunt, convenience and timeliness. So if there's something that you need, you might want to repeat a script for a medication that you're on, or you just need something very quickly, then you can pop in. You don't need to repeat yourself. They know who you are. They have your full clinical records, and they can do it in a timely manner, and you'll be out and on your way. It's often difficult to get that kind of comprehensive coverage when you're constantly having to go to a different provider. Now, that is also your prerogative, but also if you're mobile for work or for other reasons, for example, I know a lot of our mob tend to move around to different communities and family members, and, that's also okay. But I think there are options now in terms of mobile medical records, or at least being able to keep a copy of your own medical records with you is helpful, or having, that e-health or some other electronic option available, so that you're able to share your clinical history. And there's always stuff we forget. I forget stuff about my own medical history, for example. So it's nice to be reminded and make sure we don't forget some important stuff along the way.
Some really good tips there. Now, I'm going along to the doctor. I need to, first thing is make a booking, and that's different in different communities. I'm in the city. My local doctor provides an online app. So you log on, put in your details. Yep, where's that 15-minute slot with that doctor? Book. I'm off and away. So that's kind of my experience of going through. Some other people might have to go to their local service and just rock up on the day. They may not take bookings, so it may take a little bit longer. Just wondering about what you can expect when you go and book.
Yep. So, and that's true. So some services have online booking. It's convenient. You usually get to pick who you want, if you can, on a day that suits you both. Others don't. And so, I know some community-controlled services are just first in, best dressed, and that's the nature of it. But it means that you might get bumped for an acute or an emergency situation. And other services will have a mix. So they'll have appointments, and then they'll just have drop-ins. And normally the appointments are for people that need perhaps longer consultations, which would be good for a 715, for example, or, just turn up because, you've bumped your toe and you need someone to kiss your boo-boo, and away you go. So it's a matter of just finding something that suits you, that you're comfortable with, and fits in with your schedule. When you want to book a 715, be very clear about that, because they'll need to find a practitioner who is across all of that, and that they can put aside the time, because it will take at least 30 to 40 minutes if it's your first visit and it's uncomplicated, for example, or if there are multiple issues that you need to have addressed in that consultation, maybe an hour, for example. So there's all of that. So there's the timing that you need to consider. What was the rest of the question?
No, that's good. Yeah, knowing, identifying, because, my doctor only has 15-minute slots, so I had to, and online there wasn't a space for me to say I'm getting a 715, so therefore I need about an hour time or whatever might be appropriate. So I actually had to pick up the phone and go, hi, I wanted to book online, but I noticed you've only got 15-minute slots. I'm Aboriginal. I would like a 715 that takes a little bit longer. And then they were able to handle it over the phone. So it's just, you really have to be proactive and, stand up for yourself at that point when you're going to the doctor, and really kind of be as clear with as much information as possible so that you're kind of set up for success before you even get in the room with the doctor.
No, that's absolutely right.
I suppose the next piece, so we have talked a little bit about fees associated. So it's best to go to a bulk billed service if possible. If you don't go to a bulk billed service, what might people be up for?
So in the first instance, and particularly if you don't have health insurance, for example, that might cover some of the difference. On average, I think you'd be looking at about $150. Mm-hmm. So, and in some areas that's it may be somewhat less, but of course it's usually based upon time and according to your MBS rebatable item or the Medicare benefits scheme, your rebatable items are based on short or long consultations, case conferencing, and then a mixture of, and it's all usually time dependent, and also what kind of expertise you need to sort of, input into that particular consultation. So it really is then up to the individual service to make determinations about that, but they should in fact be upfront about the out-of-pocket costs, so what you will be liable for in the first instance as a part of that visit, and they will be very clear, or should be very clear, as to whether it's, completely bulk billed, so that should be $0. Whether there'll be a gap fee, so there'll be, for example, something that's bulk billed, and then there'll be a small additional cash or fee associated with that, or whether you'll be charged for the full consultation, and then you make a decision about what's going to be most appropriate for you and your family.
Yep, so that's why it's important to ring up and find out before you go, because you can, I'm sure, get a bulk billed service nearby to wherever you are, so that you aren't out of pocket.
And you're not surprised when you get there.
Exactly. Yep. No, that's definitely a good point. Now, I'd like to talk through kind of in the room. So you've gone through, you've identified that you're an Aboriginal and Torres Strait Islander patient. You've made your booking. You've gone to your local doctor where appropriate, and you're not travelling for work or whatever else. You've asked about the fees, so you know what that kind of looks like. And you're in the waiting room. It's a comfortable environment. They've got a acknowledgement of country on the wall, or some artwork, and some very, very friendly staff, hopefully. And then you get to go in and you see the doctor. So there are some things that the doctor actually has to do to make sure it's a 715 health check, like check your blood pressure, your blood sugar levels, height and weight. You might collect blood and urine tests, talk about your family history, as you've mentioned before. You've done lots of these tests and you've given some examples. Can you just talk us through a little bit more about from a kind of, as soon as you walk in the room and you sit down, just to make sure that everyone's feeling really comfortable about what to expect?
Yep, no worries, son. And of course, don't forget that as part of your first engagement and meeting with reception, there's always paperwork, right? Now, sometimes that's on a little tablet or an iPad and you get to do it electronically, which is a bit exciting, but they'll ask you the same sorts of information about yourself and where you live and your employment and your Aboriginal and Torres Strait Islander identity and status, and they'll also seek consent from you to be able to record this information, and if appropriate, they might need to share it. Now, they'll also discuss that with you, so that by the time you go in to see the doc, that should all be covered off, and they'll ask you questions about you, about personal stuff, I suppose, but it will be about building rapport and relationship, but they'll need to know information about your current health status and whether there is anything in particular that you've presented for, or whether it's for a general checkup. Then they'll go through your past medical history, anything significant, any major illnesses, any major operations. They'll ask you your social history, so where do you live? Do you live with family? Are you in a relationship? Any munchkins, how old are they? Were they, how's their childhood? How are they going? Because I want to know about that as well, and that's important. So like I said, any ops or major illnesses. Are you on any medications at the moment? What are they? How much? When you take them?
Vitamins? I've asked about vitamins.
Yeah, look, absolutely, because I think it's, even if there's supplements or they're not prescribed medications, I always identify that I take a multivitamin and that I take stuff like ginkgo and brahmi. Now, the other, as well as just knowing that as part of your broader history, those medications can also interact with other prescribed medications. So it's important to know. And some of them can actually prolong bleeding, for example. So if you were to have an operation, they'll ask you to stop your aspirin, or don't take Nurofen, or don't take your fish oil and your ginkgo within a week. So it's important to know those things, so even if they're not prescribed. They will ask you about allergies. They'll also ask you about things like cigarettes and alcohol, and it's not because they're judging you, so please don't ever think that, but it is important for us to know those things in the context of your overall health. And sometimes those they're a reflection of how you're doing socially and emotionally as well. So there's that. And they might also ask you if you take any other sort of, if you use any other types of drugs or substances. And again, that's not because they're going to go running off to tell anybody, but it's really important in the context of your overall health and well-being and your social environment. So they'll ask you, they won't always do that, but as part of sort of a comprehensive relationship with your provider, because of course we're bound by privacy and confidentiality laws as well as our professional boundaries, if that makes sense.
So anything you tell the doctor, they aren't allowed to tell anyone else without your permission?
Oh, absolutely not, unless it was going to be something that meant that you were a danger to yourself or others. So, and that's a whole other sort of conversation, but ordinarily that's not the case. And then, of course, once they've got, they'll ask you also about your employment history, because not only are they, interested in what you do for a living, for example, but there may have been certain environmental and occupational exposures, like, asbestos or smoke or, other things that might be, dangerous stuff for your hearing, lots of loud noises, heavy lifting. So, those sorts of things are also important to consider.
Really interesting that you're able to flesh those out. I wouldn't have even thought of half of those, the connecting questions and the reason behind. So it does feel a bit judgy at times, and you have to be honest, because if how many glasses of wine do you have or do you drink, and you lie to the doctor, that's not helping anyone. It's not helping you and your health. It's to kind of give those signals to the doctor about how that would be affecting your health more broadly. So it's important to be honest too as a patient.
No, absolutely. But, also trust that information stays with that medical provider, because that's their responsibility, and they need to know just in terms of your health and well-being and also those around you. So, yeah. And so once they've gone through that history, we'll get into the examination part of it.
And I'm feeling comfortable talking to you right now because we're both women. And if we're going to have a conversation about, girly bits or things that girls have to do, I would absolutely feel more comfortable with a female doctor. And so when I make a booking, I specifically ask for that. Some people might be different, but that's actually an option when you go to the local doctor. So you can say, I want a male doctor if I'm a boy, or a female, or whatever your preference might be. That's correct, isn't it?
No, that's an excellent point. Because, of course, you may want to talk about issues that are about sexual and reproductive health, or you just may feel more comfortable with a provider that's male or female, and it gives you then that additional sense of safety around the environment and the relationship to be able to discuss things. And then, and I found with the younger kids and the adolescents that I work with, they really like having a male professional or a male counsellor, because, ordinarily we don't think that young people need to see health professionals because they're supposed to be young, fit and healthy. But there are lots of emotional and social issues going on, and all the sports medicine stuff, of course, but the notion that they can have those professionals available to them to talk about things that they feel are specific to being a bloke or specific to being a woman or to being female, and it's important that you feel able to discuss them, and particularly then if it comes to issues of examination and testing, and then what you do with that information.
Yeah, no, that's a really important point. You might want to take someone in with you. That could be, an older sister or a sibling, someone for support. It might be someone, if English isn't your first language, you might want some support to help translate what the doctor's saying potentially, or just someone there for support. More generally. So that's a personal option, and you're able to do that?
Oh, absolutely you are, and I think that's a fantastic point. You are always entitled to have a support person with you, particularly if you're younger, but you could be at any stage of your life whereby you would feel more comfortable having somebody there to support you. And they might just sit in the background and not say a word, but, you are entitled to have them there. And, of course, it's also part of the responsibility of services, and I know a lot of services that are in very, what do they call it, culturally and linguistically diverse environments, that they make that available either by phone or in person for interpreters and other support people. It might be people with disabilities, for example, both physical and intellectual, to make sure that there is the right sharing of information, that the communication is appropriate and comprehensive, and that people are actually understanding what they're saying to one another. Because, you can't underestimate the sense that a lot of patients have around a power imbalance with the medical profession, and we need to level that playing field as much as possible.
Very important point there too. And that comes down to the doctor's manner, really, doesn't it? Just how well they can explain to you what the issue is. We're in clear language. You're always able to say, I'm sorry, I'm not quite sure what that means. I heard what you said, but I don't actually know what that means. And what does that, why do I suffer from that? Or what can I do to fix it? Or so, feel free to ask as many questions as you want in there so that you, as a patient, feel comfortable walking out that whatever the issues are or what you need to do to make sure that you're maintaining your health.
Oh, absolutely. And if you feel intimidated by your health professional, then you're not going to feel confident enough to be able to have those conversations or to ask the questions. And then everything ends up being only ever half done. And that's not in your best interests.
You've been listening to a podcast talking about the benefits of 715 Health Check. For more information, visit health.gov.au /715-health-check. Your health is in your hands.